A disease spread through infected drinking water and bad sanitation, cholera is soaring in much of war-torn Yemen. What's called the world's worst outbreak of the disease is affecting more than 320,000 people. Officials say those numbers will rise as reports come in from remote areas. Health workers in Yemen say it's becoming more difficult to treat those who are falling ill.
We used to receive between 100 to 150 cases per day. Then the numbers declined for about a week or so. And then, without any warning, the cases hiked up again. We are facing shortages of medicines, especially IV drips.
Yemen has been at war since 2015 in the takeover of the capital Sana'a by Houthi rebels, said by the US and others to be backed by Iran. They're fighting Yemeni government forces that have considerable military support from a coalition of Arab states led by Saudi Arabia. At a briefing to the Security Council, the UN's humanitarian chief said there was no doubt who was to blame for the cholera epidemic.
This cholera scandal is entirely man-made by the conflicting parties and those beyond Yemen's borders who are leading, supplying, fighting and perpetuating the fear and the fighting.
Mr. O'Brien called for a ceasefire so war-damaged health clinics could be rebuilt and medical workers paid. He said the UN needed $250 million to deal with the situation and so far had just a fraction of that. The conflict has also put millions of Yemenis, many of them women and children, at risk of starvation. With UN-led political efforts to end the war apparently stalled, the humanitarian crisis in Yemen is worsening by the day. Daniel Lack, Al Jazeera at the United Nations.